Brad Williams. Frugal finance. Let's get to a subject that is sort of the hot topic right now. This miserable managed medical practices in the United States. It's pathetic. It's horrible. And there's a quote that says, coming events cast their shadows before. So with that being said, things happen and sometimes statements are made in drastic ways. Here's information from a great source, CFPB, Consumer Finance Protection Bureau. Here we are. The end of 2024. Whether this agency will be around in the next 4 years is very questionable. This new administration, yeah, they're pathetic. They're probably going to wean this down, and that's a sad, sad fact because corporate America is out to, well, take advantage of, well, pretty much everyone. It's pathetic. That being said, this medical debt and nonprofit hospital billing practices is out of control. It's just out of control. We have the healthcare industry. It's a multi-trillion-dollar a year sector. And, well, it's just a horribly managed practice. You have too many middlemen. My opinion, for what it's worth, healthcare should be a nonprofit formation, period. Should not be profiting on sick people, period. It's pathetic, like the United Healthcares, who, surprisingly, it's the fourth largest company in America. Their decline rate is, well, let's just say they just decline requests for medical care are the highest in the industry. However, their profits, somewhere in the tune of $28 billion this year, is pathetic. It's pathetic. And, as I said, coming events cast their shadows before. And I suspect these actions will continue until this industry gets their head out of their butt and starts thinking about people and not the bottom line. Now, companies are entitled to make a profit. It's that risk return. But, in my opinion, not in the healthcare industry. It should be nationalized, it should be centralized, and it should be, everyone should have that opportunity without these practices. With that being said, let's get into this. This is CFPB. I use this information for one particular reason. It's quasi-unbiased. This is just the government reporting on the facts. I could go out and pull some anecdotal crap from some AI scraper, and I despise AI, period. It's just a scraper. Scrapers have been around for 50 years. Now they've just fine-tuned them, and it's just garbage in, garbage out, contrary to the crap we continue to hear about, oh, how great Microsoft is and ChatGPT and Salesforce and Oracle and what have you. It's just junk. It's non-logical. You put anything mathematical in there without directing it and holding its hands, it's just junk. But with that being said, let me just point out a couple things here. Medical debt, it is just uncontrolled. So here we have medical debt continues to burden millions of consumers. And the CFPB has made addressing this issue a central focus of their work. They've examined the various factors driving problematic medical debt collection and credit reporting practices. A key concern that has emerged from this research involves the policy and practices of, and we're going to focus on here, nonprofit hospitals. Boy, is that the biggest contradiction in the world, nonprofit. Now, how many subsidiaries can these nonprofits have to reverse this nonprofit to profitability? Okay, I'm not going to go down that road. But these institutions are required, and I've mentioned this in other videos, they're required to have financial assistance, sometimes called charity care, to help patients in need of exchange for the hospital's nonprofit tax status. It's mandatory. However, the CFPB continues to hear complaints from consumers about medical bills from nonprofit hospitals. That raises questions about whether these financial assistance programs are working as intended. They never are. Why? Because we have these horrible friggin' accountants, CFOs, who are, well, they're doing their job. I hate to say it. I think it's despicable, but they get paid by performance. They're pathetic. And I don't have any passion for these people, period. Okay? Accountants. They're just bean counters. And if it doesn't reach the bottom line, then it's not acceptable. It's pathetic. Okay, get this. Law enforcement officials have also found some hospitals fail to make the assistance available. Can you believe that? As a result, patients may end up on the hook for expensive medical bills that they should not owe. Boy. And you wonder why things are the way they are. Here's some facts. In the U.S., 58% of the more than 5,000 community hospitals, 5,000, are classified as nonprofit. These hospitals receive significant financial benefits, including exemption from federal income tax. To receive and maintain tax-exempt status, nonprofit hospitals must follow a set of IRS requirements. Wow. Well, get this. You think this new administration is going to just chop off the head of the IRS? Of course. What happens to any medically related tests, if you will, for these nonprofits? Shameful. So some of the key requirements include providing financial assistance to patients who cannot afford to pay for medical care, publicizing the availability of this assistance widely in plain language, and refraining from certain debt collection activity before patients have been evaluated for financial assistance. Yeah, tail wagging the dog, or the dog wagging its tail. The federal regulation for financial assistance policy currently do not specify eligibility or spending standards. All right. So now we have the lawyers in here. So we have the beanheads and the jerk-off attorneys, and they collectively go in and they siphon or they strain this language to the T. And their argument is it's not in writing, technically. From a legal standpoint, I would suspect that they're correct. But it's a good faith, or it is I guess, I'm not an attorney, or they say it's the letter of the law, or it's similar to common sense. The common sense is thrown out with Wall Street. This is all driven, folks, by Wall Street. Greed, greed, greed. Nonprofit hospitals are required to have financial assistance policies, but which patients qualify and how much assistance they receive is largely left to the hospital's discretion. Ouch. Those are pretty loose words. So, yeah, it's in writing. That's sort of like drinking and driving. It's in writing, but people still do it. Well, here it's sort of reversed. Here, there's the policy, but where's the enforcement? This leads to significant variations in policy by state and by hospital. Some hospitals are generous in their provisions of charity care, while others are more limited. Onerous eligibility requirements. The CFPB has reported on how some nonprofit hospitals, nonprofit hospitals, don't make assistance available to patients if they don't have a big enough medical bill. Really? If they have insurance, if they have already paid, if they have signed up for a medical credit card, or if they're not a resident of the area where they happen to get emergency care. Wow, you talk about discrimination. Financial incentives. The tax benefits that hospitals receive are not tied to the amount of financial assistance they provide. As a result, hospitals with the least generous financial assistance policy may receive the same tax benefits as hospitals with the most generous policy. Okay? Now we can point our finger at the policymaker. You think there's some lobbyists involved in this? Do you think there's some lobbyists involved in the wording of this particular policy? Even eligible patients may not receive hospital financial assistance. It's shameful. This is just shameful. Evidence suggests that many patients who are eligible for financial assistance under existing hospital policies don't receive it. An analysis of nonprofit hospitals found at least $2.7 billion in medical bills that were eligible for financial assistance, but were still billed to the patients. $2.7 billion. I guarantee that number is so misaligned. It's probably, I'm just speculating here. I suspect it's much higher. This analysis likely underestimates the actual gap between the financial assistance patients are eligible for and what they receive, as it uses self-reported data from hospitals and includes only a portion of nonprofit hospitals. Yeah, see why people are so pissed off. Many hospitals require patients to complete complex and time-consuming applications to receive financial assistance. The burdensome application process often results in a few patients completing the application and receiving assistance. A few patients. Some hospitals use third-party software to make initial decisions about whether patients are eligible for financial assistance. In theory, this could replace the onerous application process while still giving those initially denied the option to apply. However, in practice, the software often employs third-party data that may be inaccurate and software that is optimized to increase revenue. Wow, again, sad. This means eligible patients may not be offered financial assistance if a black box algorithm predicts they're likely to pay, shifting the burden back onto the patient to prove that eligibility. Yep, there we go again. It's all about the bottom line. Look, Wall Street are entitled to make some money. Not here. Not here, period. Never. Never, 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 never. And then all the crap in between with the with these intermediaries in the drug distribution cycle. Again, more waste. More waste in order to, it's just shameful. Frugal Finance does not approve of this. I don't approve of it, period. Debt collectors are pursuing hospital bills that consumers do not owe. Again, this is the government saying this. As the CFPB has previously described, patients who manage to navigate the complex financial assistance process and have their bills reduced or waived may still find themselves pursued by these scumbag. Let me reemphasize that. These scumbag, let me reemphasize that one more time. These scumbag debt collectors for these bills, even though they no longer owe them. Breakdowns in this system can have a significant impact on patients. For instance, one person whose hospital bill had been waived but was incorrectly sent to the collections reported that both the debt collector and hospital refused to communicate, forcing the patient to mediate between the two. Bastard. Seriously. Now let me point to the three: TransUnion, Experian, and Equifax. Yeah, they're just junk. They're just junk companies. And again, there's so much regulation on these three credit reporting groups, they still can't get their crap together. Yeah, it's a sad fact. Is there a way to get around this? I don't know. Let's continue reading on. Another consumer, and again, this is a small sample. A sample size of 2 is not the best sample, but this is just probably the tone across America. Go through, and I've done this because this is a subject that just really frustrates the heck out of me. I went through and I looked at the complaints for, this piece of crap United Healthcare, in addition to CVS, Aetna, Humana, Blue Shield. Who's the other one? There's one other one. Anyway, yeah, when you have a 1-star rating or less, and there's tens of thousands of people that have stated their reactions to this healthcare industry, and there's not a single positive word other than why doesn't the government come in and do something about it? All right. Another consumer recounted how a medical bill covered by financial assistance was wrongly reported to the credit agencies, causing their credit score to drop. In this example, or even more extreme cases, an individual reported receiving threats of lawsuits over a medical bill that was eligible for financial assistance. Yep. When medical debt collectors pursue payment for bills that are covered or should have been covered by financial assistance, patients often need to invest time correcting these mistakes and may also face reduced credit access and added psychological stress. Yep, it's a great system, isn't it? State-level policies provide important standards and guardrails for financials. Many states have enacted additional policies to ensure that nonprofit hospitals provide financial assistance programs that are more generous and easily accessible to patients. For instance, some states supplement IRS requirements by setting minimum income standards for financial assistance at nonprofit hospitals. Florida requires that financial assistance be provided to households that fall under 100% of the federal poverty level. And California requires assistance for uninsured households that are under 400%. Additionally, some states have put protections in place that ensure that hospitals screen patients properly for eligibility. Illinois, for instance, requires hospitals to screen patients for financial assistance at the earliest reasonable moment to ensure that the eligible patients are evaluated for financial assistance before being billed and sent to collectors. Other states, such as Maryland and Colorado, develop uniform, plain language financial assistance applications that all nonprofit hospitals must use. A simpler financial assistance process provides clarity to hospitals and benefits patients that are eligible for financial assistance by making the process more streamlined. States have also combined actions on financial assistance for future future patients with actions to address existing medical debt. For example, North Carolina recently gave incentives to hospitals to both increase the generosity of their financial assistance programs and automatically receive or relieve unpaid medical debt dating back to 2014 for individuals enrolled in Medicaid. Yeah, you can see, here's the bottom line. CFPB is taking action on medical debt. The CFPB continues to take actions to address the broader issue of medical debt, from rulemaking to public engagement. For instance, CFPB proposed a rule that would, in many cases, ban medical debt from credit reports. This action comes after the 3 nationwide credit reporting companies removed some medical debts from credit reports in 2022. The director hosted both a virtual, okay, this is just going to go on and on and on and on. Here's the bottom line. Medical-related incidents, find a nonprofit. Oh, I'm going to suggest. Work with a nonprofit. If you're underinsured or you just don't have insurance and you have a medical emergency, have something written in your purse or your wallet or what have you, saying direct me to a nonprofit hospital. Other than that, you can see how screwed up this system is. This article was a couple months ago, so it's somewhat accurate. And I bring this to your attention because you step into an emergency room, it's going to be $25,000. And even with insurance, they're going to stick you one way or another. This is just an introduction. I'll have a lot. This is just the first of many videos on this mismanaged, right? I'm trying to select the correct word, mismanaged, multi-trillion-dollar healthcare industry, and things need to change. Things need to change, and nationalizing all this would be beneficial. All right, so just to go off tangent here, Canada has a nationalized healthcare system. Europe has nationalized. In other words, it's just one package. You don't have to deal with all these money-grabbing vulture. I like to use that word that starts with W, but it's probably inappropriate. But people complain about everything. And you can look at is your glass half full or half empty? People I've talked to in Canada, they say it's there, but it's cumbersome. Well, okay. What if you come to the United States? What would your opinion be? It's there and it's cumbersome. You go to Europe, well, the waits are forever. Well, of course, there are going to be waits everywhere. Here's a crazy statistic that I was reading the other day. In the U.S., there's only 988,000 practicing medical professionals. Now, that's a broad definition, medical doctors and assistants. Only 988. So there's 320, 340, 360 million Americans. Okay. You can see the burden there in terms of the doctors. So it doesn't matter about the wait time. It can be a wait, but this entire practice could be under one umbrella and we wouldn't have to deal with all this crap. The U.S. is already spending, $4.6 trillion on Medicare? 4.6 trillion annually. So why not just put the whole thing under one umbrella? And clearly, this system's already screwed up. If it was under one umbrella, yeah, it'll be screwed up, but it won't be as bad as these practices. Anyway, I'll have a lot more to say about this, and I'll support it with more documentation from resources like this or other government agencies. And then I suspect I'll probably have spreadsheets at some point in time, but I don't want to get that in depth. The point is, this is a hot topic, probably will stay on the burner for a while. Here we are, we're coming into January, and somebody's going to probably try to sweep this all under the rug. And just cover your rear end in situations like this. Stay healthy. That's all I can say. Stop smoking, stop drinking. All right, not to that extreme. Reduce your drinking, reduce your smoking, and stay out of restaurants. Brad Williams, Frugal Finance. Williams out.